right, thank you. Well, let's get started. I know several of you, and I don't think anyone does a better presentation than Jerry Reinhardt, but I know some of you had to, probably after that presentation, John, you had to go get some Tagamet or Zantac or something just to kind of make your way through all of that. We're going to offer, hopefully, a little bit of a different perspective. I know some of the things may be somewhat of a repeat, but at the same time, I think we'll talk about some of the political ramifications and maybe just a little philosophical information too as to where we think all of this is going. So Jerry, I'm not going to give you the pleasure. Just know that you've done a great job and we welcome you back to the panel. Jerry Reinhardt. Our next panelist is not a stranger to our association. He works very closely with me all of my years of association with the independent insurance agents. I will tell you, and this is not to slight anyone else on staff, but he has always been my constant support and my constant avenue of resource for information. And I can't put enough value to Wes Bissett. Wes is Senior Counsel for Governmental Affairs for IABA. He develops legislation, provides technical expertise, offers political assistance to efforts like we're involved with today. Wes is president of the Belmore Group, which is a public policy consulting governmental relations group. Prior to establishing the Belmore Group, Wes worked for our National Association as the Senior Vice President of Governmental Affairs and State Relations. He's served as a congressional aide as well. And you will be happy to know he's not too far from his alma mater. He is an honor graduate of Wake Forest University and then got his law degree at the George Washington University Law School there in D.C. Make welcome Wes Bissett. And then also another, I think, no stranger to you. We have a relationship with CAI, Capital Associated Industries, but their president and CEO, Bruce Clark, is with us again today. Bruce is, as I said, President CEO of CAI. They're a Raleigh and Greensboro-based employers association. They're dedicated to helping over 1,000 member company associations, and they're very involved with, we offer a product that's free to our membership called HR Expert. This is where that particular service comes from, Bruce and his group. I know many of you have used that particular service. You may have also read some of Bruce's columns. They appear bi-weekly on HR and management issues for the Raleigh News and Observer, the Greensboro News and Record, and other publications. He is a graduate of the UNC Chapel Hill with degrees in business and law and has practiced labor and employment law. Make, again, welcome to our association, Mr. Bruce Clark. And then our other panelist who was supposed to be here today, David Contorno, recently went through some surgery and was not able to make it today. And it was kind of a day-by-day situation with David, and so he is not feeling well today, so we'll have to remember him, and we will miss his presence there. But I think we'll continue and get with this austere group here. Again, it's not a sexy subject, but I think it's something that all of our agents out here, members of our association, really want to know a lot about, continue to understand the ramifications of the Affordable Care Act. At times I will call it, and this is not a political statement, but please know sometimes I will call it Obamacare. That's what it's kind of known as. That's not a slight to our president. I honor the office and the person there, but sometimes just for, it may come out as Obamacare instead of Affordable Care Act, so please understand that. So it's survived 2 near-death experiences, the Supreme Court, and then the president being reelected. It's not going to be repealed. I don't think it's even going to be gutted. So it's something that we're dealing with. More Americans will probably come to accept it now that it's here, now that it's passed. If it doesn't work the way it's supposed to, I think the president's legacy will hang on this issue. If it doesn't work, I think the Republicans will probably say, we told you so for many years to come. The big pieces, Jerry, you talked about those, the coverage of pre-existing conditions, the hated individual mandate. They won't kick in, of course, until 2014. But so far, Americans have only seen what I would call the warm-up acts, the letting young adults stay on the parents' plans. But some of those things aren't really central to the law, Wes. So here's what's supposed to happen in 2014, folks. I mean, everybody's going to be able to get health insurance, even if they have pre-existing conditions. Most people will have to be insured unless they really can't afford it. Subsidies will help people pay for some of these coverages. Every state will have a health exchange. We've talked about that, run by the state or run by the feds or run by both. Medicaid will expand to carry or to cover more lower income people. So here's the question, panelists. All that said, here's your time to really pontificate and maybe give some philosophical views where you see it. So what are the odds that everything will go according to plan? Jerry, I'll start with you.
A lot of moving parts, as we've discussed this morning, and a lot of areas I didn't touch on. You talk to the medical community, you talk to hospitals, you talk to officials with the state. As I say, there's a lot of moving parts still not in place. We've already had discussion this morning, some of us, of things that are still being rolled out. The to be determined is still being determined. There's a lot of discussion and things that I read that there's a big struggle going on if the federally facilitated exchange will hit its target date. Because right now, we're to have all the exchanges in place October 1 so that you and I can go there if we want to look at an insurance policy to buy. And I can tell you, I was in Illinois last week, and the insurance carriers right now are working on their rate filings to get them to their states, and so they can have everything ready to roll out with an ACA compliant contract October. Just for a sidelight here, some of you may be wondering what's going to happen if your group policy renews, say, in September, October. What's going to happen? There's two things going on from what I'm hearing with the insurance carriers. One, you're going to get a short rate policy to carry you to December 31st. Then you're going to have an ACA compliant. Probably more carriers in that 3 to 4 month time frame will come out with their ACA compliant, which means much higher premiums. So you need to be checking with your carriers to see what they're going to be rolling out. It's going to be a struggle. I can just imagine the heat that the president and Kathleen Sebelius with HHS is putting on all the subcontractors to get everything done, because there's like 110 subcommittees working on every conceivable thing you can, all the technology issues, exchanges, just incredible amount of stuff that I viewed on the internet, and these guys have too. So it's going to be an interesting 6-7 months running up till October the 1st.
Wes, according to plan?
Oh man, you know, if throwing money at a problem determines whether it's going to work or not, then this thing would work. But the reality is there's a lot of moving pieces here. I mean, the federal government is spending literally tens of billions of dollars to put this thing together, both in the state level and the pieces that the federal government controls. There's a lot of complicated issues here. I'll just give you one example. The federal government has to create a data hub, so all the agencies who are involved in this can speak to one another. So you can imagine that includes the IRS. They've even got to check with government agencies to make sure you're not an illegal immigrant. They've got to make sure that you are a legal citizen of the United States. So there's lots of moving pieces that are involved with all this. When I think about it, I kind of like to think of what former Secretary Don Rumsfeld said. You may remember this kind of after the 9/11 attack. He was talking the problems we had out there, and he kind of broke them down into the three categories. There were the problems we know. There were the issues there were the problems that existed out there, the ones that we knew we did not know, and then the problems that we don't even know that we don't know anything about. So there were that's kind of where we are. There are certain things they know they have to address. There are certain problems they know that are out there that they've got to ultimately deal with when we know more information. And then there's kind of landmines. They have no idea what those issues are going to be, and those are the ones that are most concerning. When you consider a state like North Carolina, which is like 2/3 of the states, which will have a federal exchange, the feds have put out very precious little guidance today. I think there's something like 19 or 20 pages of regulations on how these federal exchanges are going to work. I mean, we don't even know very much about the role of agents. We know there'll be agents in the exchanges, but we don't know exactly how that's going to operate. So there's a lot of unanswered questions that have to get addressed in pretty quick order. Before I stop, let's talk about timeframes too. This is all going to go live. I mean, people will start signing up on October 1st. So, start backing that up a little bit. By the spring, plans have to decide whether they want to be a party to this. They're going to have to start applying and going through their internal processes. So there's not a lot of wiggle room here. And if I were a betting man, to cut to your question, I think it's more likely than not that there are going to be major problems when this goes live on October 1st.
Any prognostication on Wake Forest ending up with a winning record this year?
Well, Kelly, I was going to say, it's nice to be back in North Carolina. And I don't want to date myself, but I did go to Wake Forest when we did have Division I basketball. Doesn't seem quite that way anymore, but when you lose to Presbyterian and things like that,
that's not on your handout, folks. So don't look for it. Bruce, according to plan.
I sit and listen to this. I agree with what they both said, except I think the question is, what does as planned mean? If as planned, if the plan is to get us to a single payer country, I think this will eventually go as planned, because it's going to cause such chaos and such unintended consequences and such turmoil and such problems with an already semi-broken healthcare delivery system that it's going to get us there sooner rather than later. I don't know the 5 or 10 year thing. I don't know the time frame. But if going as planned means that the real motivation here was to get us to a single payer or Medicare for all kind of system, then I think it will ultimately go as planned. I hear employers say that. I hear employers actually seeking that, wanting that kind of relief. If any of you remember old Jerry Clower as a comedian, anybody old enough to remember Jerry Clower? And he used to have a skit he did, and he'd say, somebody needs to shoot up here amongst us. One of us needs relief. And the employers feel that way. They do not really want to be in the group health business. They don't like it. It's complicated. What other expense item do you have that can rise 30% in a single year? So if as planned means we're going to have so much chaos and turmoil that we're ultimately going to single payer, I think it'll go as planned. If as planned means that this is going to by and large work on kind of an 80-20 basis, kind of 80% of it will, and it's not going to be tremendous unintended consequences, then no, there's a zero chance of that. You're already seeing the unintended consequences. You already see what's happening to your physician. If you live in an urban area, your physician either does now or will soon work for a hospital. That may not be true in the rural areas, but if you live in an urban area, that is what's happening. Why are they doing that? They can earn more money doing that. Why can they earn more money doing that? Because the hospital gets reimbursed at a higher rate because it's a hospital than the doctor can get as a standalone doc. One of the reasons.
One other thing. How many out here have heard the term concierge physician?
Yes.
You're going to see a growing industry of the doctors signing up a bunch of people for $1,000, $1,500. I'll be on call for you. We're getting rid of traditional medicine.
I had my annual physical 2 weeks ago, and my doctor said, by the way, you're going to be getting a letter in about 6 weeks from me. Mm-hmm. Are you interested in concierge? That's what I'm doing.
Yeah. One other little thing. From what I discussed this morning, we in the insurance industry, we understand risk and transfer risk and everything. This is obvious how this was put together really was not insurance. I mean, think about no underwriting. Think about what appears to be no waiting period. This thing that I went through with tobacco. How are we going to find out if you use tobacco or not? All these things that were crafted by non-insurance people that are putting you having to discuss this with your clients. It's a tough situation.
Good point. All right, let's talk about the exchange just a little bit. And Jerry, I know you talked about it in your presentation. The exchange is a portal. It's a marketplace, if you will, online. The feds can completely run it for the state, or the state can do it, or both can do it. This is kind of a political question, Wes, and I'm a little confused by it. But here in North Carolina, I think that from where I see it right now with our General Assembly in session, I think the train has already left the station, and it looks like North Carolina will probably be a federally complete run exchange. That's a little strange to me in that for the first time since I think it's 1898 that we have a Republican-dominated House, Republican-dominated Senate, and a Republican governor. And most Republicans would espouse to the theory that it's all about states' rights, that no one can do it better than the state. We don't need the feds to get involved with this. So why are Republican-dominated legislatures around the country moving more to opting for complete federal control of the exchange?
You know, Kelly, when this all came about in 2010, I mean, my reaction was the same as you just described. I assumed that most states would say, we don't like this law, but we have the opportunity to take some degree of control over it. So better to have control in Raleigh than to defer and have Washington, D.C. set the 100% of the terms. I think what states have concluded, most states, because you've got 2/3 of the states now are either deferring completely to the federal government or deferring ultimate control to the federal government. Only 1/3 are running their own exchanges. So most of the states have concluded that this is going to be a train wreck, and they don't want to own it. They think when it blows up, better to have sort of our fingerprints not on it at the state level. I also think that there's a feeling that states don't really have discretion on this. That it's suggested that states can establish their own exchanges in the way that they would see fit, but I think that there's a view among state policymakers that that's really not the case. They say, they view it as we've got a little bit of wiggle room within this circle here, but other than that, we can't really dictate the terms of what we would set in a state. So I think there's some substantive, there's a lot of political reasons. I think one of the other challenges was one of timing. A lot of states were hoping, most states maybe were hoping that the Supreme Court would ultimately step in and throw this thing out. So we didn't get a decision on that until late last year. So it's very difficult if a state did want to pivot and start to establish their own exchange. There wasn't really a tremendous amount of time. I will mention, though, that states do have the opportunity in subsequent years to come back and essentially take control of their exchanges again. So, if there are 2 or 3 years down the road and North Carolina were to conclude, better for us to take ownership of this and to defer completely to the federal government, they'd have the chance to do that. The challenge, though, is that more likely than not, the federal funding that exists today won't be there. Most states that are establishing, or all states that are establishing their own exchanges today, they're building all of this through federal funding. I mean, we're talking billions of dollars in federal fundings going from HHS to the states to put their exchanges together. That funding may not be there down the road if North Carolina ever wanted to come back and reassess where they are. But
so kind of where are your numbers right now? And I know you give to all the execs of the states kind of a running tab. Where are we with states with the total federal control versus a state exchange?
So there are about 17 or 18 states that have said we're going to run completely our own state exchanges. Now they've gotten conditional approval from HHS, which means that HHS said things, states, you look like you're going to be ready for October 1st, but if we conclude between now and some point pretty soon that you're not going to be ready, the feds will step in and take it over. So it's conditional approval in about 1/3 of the states for states to run their own exchanges. Frankly, I think the feds, at least in a couple states, will step in and take that back over. The remaining states are essentially federally run exchanges. So you got the remaining states, 2/3, are all federally run. There's a group, a subset of that, 7 states are so-called partnership states where the feds will have ownership. They're the ultimately responsible party, but states can elect to take on certain consumer assistance or plan management functions in those 7 states. And so that's the deadline to apply for that sort of status was last Friday. So HHS will determine whether those 7, can ultimately reach that status. But in effect, it's really 1/3 versus 2/3, because in the 2/3, I mean, the federal government is the ultimate responsible party. They'll be setting all the rules, and the states that take over maybe some of these partnership functions will have to comply with those. So it's 1/3 versus 2/3, and there's very few. We talk about red versus blue states. There are very few red states within that 17 or 18 state group. There's Nevada, New Mexico.
Mississippi.
Mississippi's not. It's going to go federal. They got kicked out. So there's not many red states. Most are blue that have opted to go the state-run route.
Thank you. Bruce, you're here in Raleigh.
Yeah.
Kind of your take on that, why General Assembly seems to be going more to total control of the federal route.
Yeah, I think your instinct's right about the states' rights issue, that would be a typical kind of Southern Republican concept and that they would be strong on it. And I think they are. It's just that we haven't had enough time passed to go from being so anti-healthcare reform and in part winning the legislature in 2010 over the public's angst over healthcare reform to then being able to say, well, now let me flip my mindset here and let's run the exchange. So I think there still is there's that states' rights motivation there, just like you sort of suspected. It's just playing out a little differently. Then I think the other bucket of issues is that, and I imagine many of you can see where they would think this way, that somehow, some way, ultimately, and sooner rather than later, the state's going to get stuck with some of the bill. Don't know how exactly. It's not really, you can't really read that in the law, but there's this visceral feeling that like everything else that comes from the federal government, at some point, they're going to start offloading it on the state. And that is something that's very non-Republican, at least in the fiscal terms. We're going to stay in control of our budget. It's not going to be controlled by the Fed. So I think that's just a couple of add-ons to what Wes said.
Good point. A little bit more about the exchange. So let's just say if the price of the coverage in the exchange is too high, are people in for what I would call a serious rate shock, Jerry?
Yeah, there's going to be a serious rate shock. And I think watch for the nightly news and the 24-hour news shows and all the talk radio starting about probably November, December, when people start getting their rate notices, and definitely in January and February. There's going to be a lot of very unhappy people. A lot of them are going to be employers. They're going to see this huge sticker shock. As I said, 20 to 30% premium increase, plus these fees that I talked about also. They're going to make some very, very tough decisions. Maybe we were paying 90% of the employee costs. Now we're not going to pay anything. We're going to take the penalty. So we're going to cut you off. Maybe we were paying all of your costs, but we're going to pay now then so we don't violate the 9.5%, but we're not going to pay anything in the dependent cost. And you're going to see a lot of employees probably go, wait a second, they're turning their back on us. And we all know why businesses really and truly get heavy into benefits. You want to hire and you want to keep the employees you're looking at. I mean, if you're in an environment there, right here in the Research Triangle, you got to be that way. But you go out to Morehead City, you go out to New Bern or whatever, there's going to be only just a few bellwether employers. You let one or two of them, bigger employers, say, okay, we're going to cut this loose, we're going to pay the penalty. Watch all of the smaller companies, the service providers. It's going to be a domino effect, and there's going to be some unhappy people at the end of the year.
Bruce, you represent employee groups. Your feelings?
Yeah, Jerry's exactly right. I mean, Jerry's presentation spent a lot of time talking about whether you're a large employer or a small employer, and that's what the way the law talks about it, but really the complexity is much deeper than that, and Jerry just indicated that. It's really more about, what kind of industry are you in? What are your margins like? Are you hiring professionals? Are you hiring laborers? Are you in New Bern? Are you in RTP? Those are going to be the bigger filter for an employer about whether I continue to offer group health and what I pay for it and what the co-pays are and all of that, than whether I'm under 50 or over 50. That under 50, over 50 thing is important on the margins. I can not hire somebody for maybe a year and stay under that thing, but that's not a good business plan, if you're really going to grow. It's going to be more about those factors that I listed, and I think that's why the tipping point philosophy is important. So if you start seeing certain industries because of what they're in, what their margins are like, or where they operate and who they hire and all those kind of things, I do think you'll see that tipping point come in different segments at different times.
Wes, I'm going to go off script just a little bit, and I want to really talk about something that I know you have a lot of knowledge of and understand really as it relates to individual states, and that is the role of the navigator. And I know we have a concern here in North Carolina as to the role of the navigator. Is that going to be a licensed person? Who is that going to be? Is that going to be some type of business group out there that's going to be taking it on to make these recommendations to citizens within the exchange? we've kind of adopted here as a part of our legislative strategy that we think people need to be licensed, or they need to somewhat look like a licensed agent if they're going to serve as a navigator. Talk about that a little bit, and kind of what the Iowa, and we're using the Iowa model somewhat as an example in our piece of legislation, but talk a little bit about that.
So how many people are familiar with this navigator concept or have heard a little bit about it? Okay. So, there are a lot of wonderful elements of the ACA. Jerry talked a lot about them this morning. One of the overlooked ones, and one that directly affects us, is the Act requires that every exchange, so in every state, because there's going to be an exchange in every state, there has to be what's called a navigator program. And what's envisioned here is that there'd be these people that the exchange would select and pay to essentially do many of the activities that you do today. So the Act requires that these navigators, who could be all sorts of different types of categories of entities. They could be labor unions, they could be chambers of commerce. I think most people assume that they'd be sort of community, consumer-based groups. These people are directed and actually paid by the exchange. And in the case of North Carolina, these will be people who will be paid by the federal government to sit down with consumers, to sit down with small businesses, and to essentially walk them through the health insurance enrollment process. And if you're thinking to yourselves, sounds a lot like what I do today, it should, because that's what many of these groups intend. They argue that agents bring too much cost to the process without sufficient benefit, and that we can essentially replace that and have a government sort of grant process where these navigators would step in and do everything that you do today. Obviously, we were very concerned with this. We did a lot, as much as we could during the legislative fight, to sort of neuter the provision as much as possible. But one of the things that we're doing in response, because it is an element of the law, is approaching states and saying, wait a second, these people, if they're going to do anything close to what we do, need to be licensed first and foremost, so that there's not only that they've completed some sort of training and taken an exam and met certain qualifications, but also so that they're subject to the jurisdiction of the state. HHS is not going to have a lot of people on the ground regulating consumer interaction with the exchange and with navigators. I mean, that's a role that's traditionally been performed by state regulators. So, one thing that's very important is to make sure that navigators, or anybody who's out there consulting or meeting with the public about health insurance options, is subject to state authority. So what we've been pursuing in North Carolina is one of the leaders in this effort, is attempting to pass state laws that would establish a licensing requirement, establish and make clear that navigators are subject to state law, that when something inevitably goes wrong, and something will inevitably go wrong because a navigator will offer bad advice, that the state can take action against them. I mean, it's important to remember here that the stakes of all this for consumers they're incredibly high. I'll give you one example. The decision about how to deal, if you're someone who qualifies for a tax subsidy, whether to take that subsidy in advance or to wait until the end of the year, it's a significant decision. If you mess that up, you could get a huge tax bill at the end of the year because you've taken too much subsidy, more than you were entitled to. So if a navigator ultimately, either intentionally or unintentionally, misleads a consumer on that, that's got incredible impact on that particular person. So we're also doing some other things. I know North Carolina's looking at this as well, limiting exactly what navigators can do. The law requires that they sit down and help people enroll, but that doesn't mean that they're entitled to offer advice or offer recommendations. I mean, they should be playing as passive a role as possible and not putting their hand on the scale and affecting what kind of plan a person ultimately enrolls in. That's the kind of elements that we're looking at as well. If a person's got existing coverage that their agent put them with for probably very good reasons, one of the things we've urged states to do is that require the navigator to refer that person back to their agent, so that the navigator doesn't make some inadvertent error that has all sorts of unintended consequences. It's a hugely significant issue. This is a very complicated process. I'll give you one more example. The Federal Exchange has come up with a draft application. Can you guess how many pages it is? 21 pages, right? So, there's a lot of complicated questions, and navigators who are going to have no real experience in these issues, they're not going to be able to offer the advice and guidance that you all do today. So, it's a concern what navigators are doing, but I also think there's some opportunities for our folks as well.
Yeah, thanks. Guys, I'm going to read a statement to you. This was actually in a Blue Cross Blue Shield newsletter back in the latter part of 2011. So I'll just read it to you. It says the Affordable Care Act makes many broad, overarching changes to the way health insurance is purchased. New requirements on medical spending for insurers, exchanges, and changing roles for traditional health insurance agents will all contribute to a very different healthcare insurance landscape. Brokers will be at the forefront of these changes as the primary actors between health insurance insurers and consumers. Jerry, what do you think of that statement?
Well, it's a great statement, it's an admirable statement, but the role of the navigator may change that somewhat. The agent that today handles the small business, property and casualty, maybe you also handle their health insurance. I see you can definitely be a player in that, but I think you need to start right now in 2013 educating them on what's going to happen, because there's going to be some sticker shock for every size business, and especially large businesses when they get hit with a bunch of these extra, the penalties and stuff that's going to come about. You guys have the relationship with them. A navigator does not have a relationship. They go to the business owners go to their attorney, they go to their CPA for advice, basically from a reaction standpoint. You can be there on a pro-action standpoint. So I see that you can definitely be there, but you got to have a little bit of knowledge of what's going on in this area, and I see a role there. There's no question, whether you sell it or not. If nothing else, to just kind of pat them on the head and make them feel a little better about things, even though sometimes there's not great things to make them feel good about it.
So a public migration, if you will, from traditional healthcare insurance agents and brokers to the exchanges, Bruce?
Yeah, I think so from the individual market perspective. I think that's really, it's really an individual market question right now, and that seems to be what the carriers in this state view the marketplace or the exchange as right now. They seem to be de-emphasizing the small group potential, and although that obviously can change over time. Blue Cross said something last week that said they were trying to, I think, quell concerns of agents, and said, at least at this point, they don't see any commission compression, that they've got room in their medical loss ratio for the commission, Blue Cross North Carolina, that is, and so they seem to be thinking that right there. But I've also been in rooms with carriers, with the executives and government relations people from carriers that express a whole lot of concern and uncertainty about their own business model. I mean, they really do. You wouldn't think somebody that's got billions in the bank and has, X percent of the market in the state or the country would be thinking that way and worried that way, but they are. They are. So I don't know that anything that we see right now or that we can really sort of speculate on in the coming year has got a lot of longevity to it. Everything's in such flux.
Wes, I mean, our members, it's all across the board, but most of our members, employee benefits, healthcare represents somewhere 20-30%, average of their total business. I mean, where do you see it?
Well, I think I agree with Bruce about that I think it's a different outcome perhaps for the individual versus the group market. I mean, even HHS has sort of acknowledged, I think begrudgingly, I think it was their hope maybe that there wouldn't be much of a need for agents or brokers and even in the group marketplace going forward. But based on sort of all their research and interaction with employers, and you look at data and research that's out there, employer after employer, it comes in very high, showing that they want to continue to work with agents or brokers. There's no question about that. Everything that Jerry ran through today, it's incredibly complex and complicated. And your clients on the group side are going to be looking for someone who has not only sort of understanding the insurance market, but understanding what's going to be coming down the road as a result of the act. So I do think it's not inherently all a negative thing, especially on the group side. I think there are some opportunities for agencies who are proactive to get out there, reinforce even more than ever, your role and have your clients looking to you for guidance on these issues. I think on the individual side, because of the exchange and the way it's going to set up, and you'll be able to go online and enroll, it may be a little different there. But I think even in that environment, I think it remains to be seen. This is also incredibly complex that even individuals may want to go to somebody that they know and trust and say, all right, tell me what's the difference between these plans. Which one do you like? Which one should I be in? Tell me the pros and cons. What do I need to be thinking of because of some particular health condition that my son or daughter might have? I even think on the individual side, those opportunities still exist. One thing I should say, I know there was some angst about whether agents or brokers would even have a role with these exchanges. The federal folks have said that in these federal exchanges that agents and brokers will be able to enroll their folks in plans. So it's not as though we're cut out. So there is an opportunity, but there's definitely going to be some competition there.
Couple other comments. There is some carve out, some things that might lead you to start looking more and more at the, from standpoint of your traditional health insurance, to start looking at some ERISA self-funded or partially self-funded. There's some openings there, so that's an area to start looking at. And if you're not familiar with it, find brokers or groups that get involved in that. There's some potential opportunities there. Your business owners want options, and you take an option with your leading carrier, and they look at that and say, look, you got to find something else. You better have some other options. Secondly, I think there's going to be, the carriers are going to come out with all sorts of various ancillary products. Obviously, you already have availability to write your group life, your group disability, the vision, dental. This doesn't address that at all. But also, there may be carriers come out with things that kind of dovetail with the ACA compliant policies. Just as we saw back in the 60s when Medicare came out, carriers came out with Medicare supplement insurance. And so we may see things like that. So kind of watch for that as other revenue streams for your agencies.
Hey, can I mention one more thing?
Please.
One thing to keep in mind, we're talking a lot about the way in which the exchange is going to operate, but there will be a marketplace outside the exchange. So I think it remains to be seen how these two markets will compete with one another, whether there'll be adverse selection, all those kinds of things. The companies that are going to opt to put plans on the exchanges, they're going to have to pay a 3.5% fee based on premium to even get their plans on the exchange. So it'll be very interesting to see, the competitive nature between inside and outside the exchange. But especially on the group side, you may have a lot of clients who still find plans that are available outside the exchange to be preferable for maybe lots of different reasons, including cost.
Bruce, your members, I think some employers are undoubtedly contemplating whether or not to, basically play or pay. How do you see this shaking out? Let's talk about the groups 50 and above, and also the groups 50 and below, and just that whole interpretation of employees who maybe work fewer than 30 hours a week, who are not going to be considered full-time employees. I mean, talk a little bit about that and just the threshold.
Yeah, we survey employers every year on healthcare costs and benefits in this state. So we've got a statewide survey. We had about 800 employers participate in the last one. And so we get very rich data by region. We get, and then we ask them some more narrative type questions. Okay, here's your data, here's what you pay for single coverage, here's what your deductible is, all that. But we also ask, what are you planning to do next? Those kinds of questions. And what we see, and it still kind of goes to that tipping point thing, and it does vary by industry, but here's some stats from our last survey. 63% of employers said they believe that healthcare costs will increase due to reform. Not just trend, but due to reform. So 63%, and that's way up from when this act was first passed. 1.3% think it'll decrease. I don't know I haven't met them yet, but they're still, to your point, they're still in this trying to straddle these two worlds and make it all work. They really are still not making dramatic decisions. 69% say they still plan to offer insurance. And about another 25% say they don't know. So there's just a very small percent that's saying, I plan to get out of insurance. We just don't have evidence of that yet. 31% say I'm not going to change my benefits. 45% don't know. 60% say I'm not going to change my eligibility. 30% don't know. So this is a status quo kind of straddling the fence, watch and learn sort of world. They are increasing wellness. They are increasing the payroll deduction on plans, but that's been going on for years, that plan design kind of strategy. So we're still straddling this, try to hold it together, try to keep it together, and watch what my peers are doing, watch what my industry is doing, watch what the feds are doing. It's one of these things people say, well, this will work until it doesn't work anymore. And so this strategy is going to work until it doesn't work anymore. And I think that's why we're going to see somewhat of a tipping point.
I'll ask this to anyone who wants to address it, but again, talking about the penalty, You know, the first year, I think the penalty for ignoring it is like $95 or 1% of income, whichever is greater. And then the penalties rise by, I think, 2016. So how many people, Jerry, I'll ask you this, how many people will just refuse to get insurance and pay the penalty just in protest?
Congressional Budget Office in May of 2010, shortly after the law was signed, they projected 3.9 million. October of last year, it was at 6.7 million. I heard a survey here maybe 2 weeks ago that they're now estimating 7 million. And Tower Watson did a survey back in May, right after the law was signed, surveying a lot of employers, 1,800 around the country. And at that point, they found 87% felt they would continue to offer coverage. They provided coverage then. 87%, from what we know, we're still going to do it. Latest I'm hearing is around 76%. So as we're beginning to find out what's in the bill, well, I think we had a politician who said we got to pass it to find out what's in it. But anyway, as we're beginning to find out what's in it and understand the penalties and potential penalties, a number of businesses are getting with the consultant and saying, hey, what do you think?
Wes, any comment there?
No, I mean, I think that the conventional wisdom is that the penalties are too low. I think that's right. Especially for younger, healthier people, when the band that Jerry talked about this morning, when the 3-to-1 band kicks in, and I mean, it's going to, on the healthier side, really add to the rate shock effect that a lot of people are going to see. So I mean, it's not hard to envision a lot of those folks saying, forget about it. I'm going to, I'll take the penalty. Maybe at least, maybe those first couple years, especially while all this is still playing out, people are getting their arms around it. There may be some essentially protest payments. I think you were sort of alluding to.
Yeah.
People saying, forget about it. I'm going to essentially almost take a political position by paying the penalty, and I think there'll be some of that, especially in the first couple years.
Bruce, are you hearing some of that among your membership?
Well, you hear a lot of frustration, but I think it goes back to, am I going to, shoot myself in the foot? Am I going to lose my professional staff? Am I going to lose my employees? Am I going to take a political stand in order to, shoot myself in the foot? So I think most business people are looking at it. It's a dollars and cents thing, not just the premium cost, but what happens to my workforce, and trying to weigh all that and trying not to stand out. Trying not to get the word out that this is the place you go, but they haven't got any health insurance. You just don't want that if you're in a competitive hiring market.
So guys, the last question. Will the law control health cost? Jerry?
I'm sorry?
Will the law control health cost?
Will the law? Well, it's still a free market, and the insurance companies, obviously, they've got to look at money in, money out. There's a lot of pressure on them with the MLR and the various other things. We've already seen a couple of major players throw the towel in. The Principal and the Guardian, they've gotten out. There's some lesser known carriers up and down the eastern seaboard and in the Midwest, they got out. A lot of companies right now are doing the actuarial studies to find out how we can make a dollar at this, but not have to give back so much of it. I think really and truly that we're going to be looking at the next 4 to 5 years, less and less carriers in this market. My prediction, if I was to look at it, I'd say probably by 2020, folks, we're going to be looking at a single payer system. I really do.
Wes?
It's called the Affordable Care Act, which is evidence that truth in advertising doesn't apply to the names of congressional statutes.
Right.
I mean, it's hard to see where any meaningful reduction of costs through this act. It's probably going to see the opposite.
Bruce?
Yeah, and I like to think we have a free market in healthcare. We really don't. I don't think it's not a free market in the sense of any other free market that you're used to thinking of as a free market. I mean, these carriers are really just money changers, right? They're paying the providers, and they got a fee for the administrative stuff and some profit. And they don't, how are they really going to compete with each other? I don't really see that in a meaningful way. Somebody else is providing the service. So, we haven't had a free market. The hospitals are taking over these regions. There's fewer hospitals. It's not just the carriers are fewer, their hospitals are fewer. The little rural hospital that was, had half its business was Medicaid, is having to join up with the big all this stuff there is no free market in healthcare. There hadn't, I don't know, ever been one in my adult memory, and it's getting worse. And so that's another reason that the single payer thing is, I don't know how you avoid that. We're too far down the path. We've created this kind of muddy middle ground. It's almost like the worst of both worlds. How long can we take this worst of both worlds thing? So that's what
Well,
we...
one other little thing,
Sure.
I've had people many times ask me, if the political landscape in Washington and Congress changes, could we ever undo this? And I always come back with this question, and I'll ask you, is there any way for us to undo Social Security? Is there any way to undo Medicare? So I'll end it with that. The longer we go, we got it.
Well, with that, folks,
On that happy note.
On that
on that happy note, we
I
have...
still got 2 drink tickets, but I think they were for
we have-
last night,
yeah,
weren't
they
they?
were.
Oh, yeah, that's right.
That gives me an idea. Maybe we can do that for the next continuation of this subject. But folks, I hope that this has been somewhat educational for you, at least has enlightened you to at least being a part of maybe not knowing the stuff that we don't know,
Right.
Wes. But I hope that you've at least gained a little bit more of an understanding of what the system is supposed to look like, and maybe the role of the exchange and the navigator as well. Would you give our panelists a round of applause? I think they've done a wonderful job. David, with that said, maybe you can help this group get pepped up a little bit as they drive to their home places.